Good evening and welcome to the COVID-19 update on Channels Television. I am Kayode Okikiolu. Here are some of the highlights. Nigeria gets 200 ventilators from the United States to battle COVID-19. The schools struggle to adhere to COVID-19 protocols after federal government ordered resumption of exit classes. After over 3 months without a single COVID-19 case, New Zealand records 4 new infections. Thank you for joining us on the program. We begin with the United States' kind gesture to Nigeria with a donation of 200 ventilators to help the nation manage the effects of COVID-19. At the handover ceremony in Abuja, the American ambassador to Nigeria, Mrs. Mary Leonard, commended Nigeria's response to the pandemic, saying the U.S. government is committed to further supporting the country beyond the over $54 million spent since the outbreak of the virus in the country. While receiving the donation, Nigeria's Minister of Health, Dr. Osagie Hanire, highlights the urgent need for further collaboration towards finding potent vaccines and cure for the virus.
Congratulations. Let's put our hands together.
Call it a promise kept, and you may not be wrong. The presentation of these 200 ventilators to the Nigerian government is a redemption of the promise made by the American President Donald Trump in April this year to assist Nigeria's response to COVID-19 with modern ventilators.
Thank you very much.
The U.S. ambassador to Nigeria describes the gesture as an indication of a robust diplomatic relationship which both countries have sustained for over 50 years.
Our support includes training.
She also applauds Nigeria's response to the pandemic, assuring the government of continued support.
Nigeria is now one of just 2 countries in Africa to have an oxygen roadmap that seeks to fight against pneumonia, hypoxemia, and now COVID-19. While we all continue to face unprecedented challenges as a result of COVID-19, I would like to laud Nigeria's efforts in taking early action to combat and mitigate its spread.
Receiving the donations on behalf of the federal government, the Minister of Health highlights the urgent need for further collaboration towards finding potent vaccines and cure for the virus.
This donation consists of 200 modern ventilators, as I have just seen, which, as we all know by now, are a critical component of the response strategy to save the lives of persons who have been severely impacted by this viral infection. I wish to conclude by requesting the United States government to lend its full weight to global efforts to find efficacious therapeutics and vaccines to neutralize the threat of COVID-19 to the global community, and to guarantee fair allocation to all countries and people.
As you know, that the United States has expressed some reservations about the practices of the WHO, and so we're currently looking at ways that we can work through other partners, but without undercutting the financial commitment and the commitment that we have to international health. And I expect that that will continue.
In April this year, President Muhammadu Buhari had a telephone conversation with President Donald Trump, where the U.S. president promised to assist Nigeria with ventilators. The gesture will no doubt enhance the efforts of the government to save more lives during this pandemic.
290 new cases of COVID-19 in 24 hours brings Nigeria's tally to 46,867. 160 new discharges bring the total to 33,346 as fatalities reach 950, with 5 deaths reported across the country. A look at the total figures from the NCDC shows that 7 out of this national total have been discharged. 12,571 remain active, while 2% of those infected have so far succumbed to the deadly virus. A breakdown of the latest figures across states shows that 15 states and the FCT account for Monday's positive cases. Lagos and Plateau recorded 82 cases each, Oyo 19, FCT 18, Edo 16, Kano 15, Enugu and Ogun 9 each, Kano and Kwara 8, Cross River, Ondo, Rivers 5 each, Ekiti 4, Imo 3, and Borno with 2 cases. The NCDC also reports a total of 319,851 tests conducted nationwide. Well, that's about 1,600 tests per 1 million people. And simply put, only about 0.16% of Nigerians have been tested for COVID-19. Now to the education sector. The National Examinations Council has released guidelines and schedule for public examinations in the COVID-19 era. Well, briefing journalists at the council's headquarters in Minna, the Niger State capital, NECO Registrar Professor Godswill Obioma announced the new date for the NECO SSC examinations as October the 5th to Wednesday, November the 18th. On the guideline for the conduct of the examinations, Professor Obioma emphasizes the need for existing protocols like decontamination of venues, hand washing, wearing of face masks and others to be strongly enforced. So far, over 350,000 students have registered for NECO's basic, senior and common entrance examinations nationwide.
NECO Senior Secondary School Certificate Examinations will begin on Monday, 5th October 2020 and terminate on Wednesday, 18 November 2020. We've taken account of the various election days during this. We've also taken account of the overlap between NAPDEP and NECO exams. We've also taken account of the prospective public holidays that will fall in within those periods. The last but not the least is the National Common Entrance Examinations, usually taken by primary 6 pupils, those that have the capacity and able to proceed to the junior secondary school, especially into federal unity colleges, will be held on Saturday, 17th October 2020. Gentlemen of the press, ladies and gentlemen, in addition, the National Examinations Council has scheduled the person receipt to take place on Wednesday, 11th and Thursday, 12th September and November 2020 for the prescribed relevant subjects. NECO has also prepared comprehensive examination timetable for all of these scheduled examinations in harmonization with other exam bodies, WAEC and NAPTEP.
Let's head over to Enugu State, where the government has begun monitoring all public and private secondary schools in the state to ensure compliance with NCDC COVID-19 safety protocols. The idea behind this, according to the Commissioner for Education, Professor Uche Eze, is to create a safety environment for teachers and students and teach them the importance of strict adherence. He also said the government has worked out modalities that will ensure temperature check, steady supply of water, soap, and hand sanitizers across all public schools. On their part, school principals have promised to be on the lookout for defaulting students to call them to order.
Came here and the first thing we checked was to see whether we have the facilities for hand washing, and we saw one. I'm happy with that. It is big enough and there is water in it, and we have soap. And I also saw you when you wash your hands. The next thing is social distancing. That's why we've gone around the classrooms to see the arrangement of seats. It is expected that there should be a minimum of 2 meters in between seats to ensure that there won't be any physical contact. And I'm satisfied with. We are working closely with schools to ensure that water is supplied, so that these children can wash their hands, and because basic hygiene is very critical.
As part of efforts to cushion the effect of the COVID-19 pandemic on the livelihood of the vulnerable in Nigeria, the private sector's coalition on COVID-19 has commenced the distribution of food palliatives to the people of Kogi State. Flagging off the distribution of the food items in Lokoja, the Deputy Governor, Edward Onoja, commended the private sector partners, or commended them rather, for providing a well-equipped isolation center for the state. The beneficiaries, mainly the market women, widows and those living with disabilities from the 21 local government areas, thanks the government and donors for the gesture. Dr. Gloria Adeto, health educator and senior lecturer at the Department of Public Health, National Open University of Nigeria, joins us this evening from our Abuja studio. Thank you for joining us on the program. Well, I'd like to begin by taking a closer look at Nigeria's figures. And you see that an analysis of our figures shows that 5 states account for 60% of the cases we have recorded so far in Nigeria. Now, on face value, that might not say much, but as a health expert, what does that tell us to begin with?
That tells us that those states, we need to take more care of those states that are giving us those figures. One is probably due to their population. 2 is due to the fact that some of these states that are taking this lead, they are like central states. Like if you look at Edo State, for example, it's a central state where many people pass by to go to other states in the nation, and stopping by there to eat, to do all sorts of things may predispose them. More so, the people in that state, they tend to travel a lot, because before now, we know that people in Edo State are always found in Italy and some of the European countries, people reporting that they are involved in many acts over there. So they come into the state with a different kind of infections, perhaps, and now that it is COVID, it may be the reason why it is high there. Lagos, for example, is densely populated, and to control COVID in Lagos is not an easy task. And coming to the north here, you look at Abuja, that is also there, is the federal capital. Abuja, the people tend to relax a bit. They are not taking things as serious as one would have expected to see. And Oyo State, very close to Lagos, is also densely populated. And I would say the hygiene in that state also is questionable in Oyo State, particularly the state's capital, Ibadan. So these states need to have the attention of the PTF, Presidential Task Force, because they need to be looked into specially in terms of giving them a more specific health education and getting to the suburbs of those states. That is my own view about the states taking the lead in these cases. They are not minor at all.
Right.
They are not. The numbers are not minor.
Absolutely. Just to reiterate those 5 states that you have highlighted, Lagos leads with over 15,000 cases, the FCT with over 4,000, Oyo, as you can see there, with over 2,000, followed by Edo State with 2,398, and Rivers with 1,944. Now, we have that information. The PTF has given out that information, as well as some other informations, going to the local governments. About 50% of our cases are in about 20 local governments. So we have that information. And the big question is, how does that help, or how should that help in structuring proper response in this fight against COVID-19?
Yes, now that we have those figures, they are quite high. And in my mind, I feel if we can handle those states specifically, then there will be a reduction in the number of COVID-19 cases in the country generally. So there is need for close monitoring both in the cities and in the villages, because that close monitoring, as well as continuous health education. The people have heard, yes, the PTF is trying its best to create awareness. They are really doing well in that area. But maybe more specifically, to get to the interior, because some of those people may be there and they are not doing it right. Perhaps our monitoring may be limited effectively to the cities. But when we go to the interiors, we may find the need to really help educate the people the more, and let them know the risks and the need to comply to these preventive measures of COVID-19. So work needs to be done more in those states, because like if you have two people, for example, and one is in a critical condition, a more critical condition than the other, we face the one that is a more critical condition. So these states are what I would want to call the critical states, the at-risk states in the country. Every state is at risk, but these very ones need more attention.
Well,
and that should be the focus. Now, the strategies should be mapped out.
Well, we clearly have our work cut out for us. But I'd like to thank you so much, Dr. Gloria Adeto, Senior Lecturer at the National Open University. Thank you for sharing your thoughts with us this evening.
Thank you so much. Thank you for having me.
Well, we take a break now on the program, and when we return, COVID-19 makes a return to New Zealand after 102 days without a single local case. Do stay with us. More donations of food and relief items, this time in Enugu State, where the state government receives the donations on behalf of the vulnerable and distressed in the state. The donation, comprising 100 truckload of food items from CACOVID representatives, was received by Governor Bala Mohammed, who directed the State COVID-19 Palliative Committee to commence distribution to beneficiaries across 20 local government areas of the state, just as he warned against diversion. Not less than 200,000 households are to benefit, with each household expected to receive one food basket of assorted food items.
You will recall that during the total lockdown, which affected 3 local governments, namely Katagum, Giade, Zaki, a total of 7,000 households in Katagum, 4,000 households in Giade, 15,000 households in Zaki had benefited from the distribution. Today, we are extending the gesture to all the to all the 20 local government areas. The committee used estimated demography of the local governments for distribution of the palliatives. Accordingly, I have in the affected areas. Ladies and gentlemen, let me sound a word of warning that these items must be handled with utmost care and must be delivered to its intended recipients, that is the vulnerables. I have a third eye on the mode of operation of this distribution. A grain or any component of these palliative commodities diverted by any person or group of persons will be treated as an act of sabotage and theft. I will therefore urge all of you in the distribution chain to justify the trust and confidence reposed in you.
Well, let's speak with medical microbiologist Godwin Obande, who's a doctorate candidate at University of Science, Malaysia. He joins us via Skype from Kubang Kera in Malaysia. Thank you for your time on the program today.
Thank you for having me.
Yeah, you see, Nigeria's COVID-19 figures are coming in triple digits, but for Malaysia, it's more in the double figures, the latest being 11. So let's start on a general note. How is the response, protocols, and adherence to these protocols where you are?
Well, I would say that Malaysia has pretty well been able to handle the pandemic in a manner that I would term satisfactory. At the start of the pandemic, first cases being recorded sometime in January. A total lockdown was evoked in March, on March 18th. And that ran through the entire period of April down to last month when a new phase was instituted. So currently, Malaysia is under what is termed the Recovery Movement Control Order. And at the moment, the use of face mask has been made mandatory since the 1st of August, the 1st of this month. Failure to which you are fined to the tune of 1,000 ringgits, which is almost about 100,000 naira fine for defaulting. So there are measures in place that are being adhered to, and strict compliance is in place also to ensure that people adhere to these protocols.
Well, I know you've been following the race to get a vaccine. Now, Russia says it has developed a COVID-19 vaccine ahead of other countries and companies. And, well, they seem to have gotten that silver bullet. I know Malaysia's Research Institute is working on something, participating in vaccine trials. Any news regarding that?
At the moment, Malaysia isn't part of any ongoing clinical trials. At the last, the government has said that they would prefer to wait for data to be turned in. They want to be sure of the level of safety and the efficacy of the vaccines before they decide if they are going to be part of any clinical trials or not. So at the moment, Malaysia isn't part of any ongoing clinical trials, but I guess the government will be open to accepting any such offers. What is in place is that foundational stage researches are ongoing to see if institutes here can also develop local vaccines. Aside that, the best that has been done is that 2 companies so far have been approved or appointed to be part of the packaging process in the case that a vaccine is finally approved for COVID-19.
Well, I'd like to thank you so much for sharing your thoughts with us. Godwin Obande is a medical microbiologist and a doctorate candidate at a university in Malaysia. Thank you so much.
Thank you for having me. It's a pleasure to be here.
So on the foreign scene, just 2 days ago, New Zealand marked 100 days without a single COVID-19 case. But if there's anything we've learned about this virus, it will be the fact that it is unpredictable and there's a need to always stay vigilant. Well, New Zealand has now recorded not 1, but 4 locally transmitted COVID-19 cases, all members of one family. This has prompted Prime Minister Jacinda Ardern to announce a 3-day lockdown in Auckland. Here is more on this and other development on our COVID-19 Global Update.
Russia, which has nearly 900,000 coronavirus cases, says it has developed the first vaccine offering sustainable immunity against the virus. President Vladimir Putin says the country's health ministry has given regulatory approval for the vaccine after less than 2 months of human testing. He adds that one of his daughters had used the vaccine and that she was fine after having had an increase in temperature. The health minister says trials of the vaccine would continue, involving thousands of people. Meanwhile, the World Health Organization says they are in talks with Russian health authorities and are discussing the process for possible WHO pre-qualification.
We are in a close contact with the Russian health authorities and discussions are ongoing with respect to possible WHO pre-qualification of the vaccine. But again, pre-qualification of any vaccine includes the rigorous review and assessment of all required safety and efficacy data.
Indonesian President Joko Widodo says the country hopes to start producing coronavirus vaccines by January if late-stage human trials prove successful. The president was in Bandung, West Java province, to launch the Phase 3 human trial for a COVID-19 vaccine candidate developed by China's Sinovac Biotech Limited and Indonesia's Bio Farma, which will involve as many as 1,620 patients.
After 102 days, we have our first cases of COVID-19 outside of a managed isolation or quarantine facility in New Zealand.
In other developments, New Zealand has detected its first locally transmitted coronavirus cases in more than 100 days.
As of 12 noon tomorrow, Wednesday, August 12th, we will be moving Auckland to level 3 restrictions for a period of 3 days until midnight on Friday.
Prime Minister Jacinda Ardern said 4 people tested positive from the same household. The source of the infections is not yet known.
Well, let's head over to our website, channelstv.com, where you can find all the latest updates on the pandemic and much more. All you need to do is log on and access the news and health, politics, business, sports, Africa. And you can catch up with the story. Germany questions the quality and safety of Russian vaccine, all at your fingertips. And that's the COVID-19 update. Thank you for watching. I'm Kaya Doki Kyolu. To stay safe.